Okay, so we are recording the session now, and we're just doing a recap of day one and the different elements that we discussed during the first session. So the final one on the list then is just always to be keeping learning, and I think that that comes with, you know, the thinking of all of these elements together, you know, and we're always looking to be learning and adapting our work, and specifically from that measurement piece and monitoring our progress, looking at the social media analytics. Like, there's huge amounts of learning in that, seeing what content, what messages, what was really resonating with our target audiences, what's having impact, and then that helps to guide our work going forward as well, you know. And like, I'm still constantly learning as well, you know, and I think definitely when it comes to digital campaigning and advocacy as well, because as we mentioned, because as the platforms are constantly kind of changing, and how audiences are consuming content and how they're communicating online, that's constantly changing. I think, you know, it's up to us to be able to adapt and evolve as that's adapting and evolving as well, you know, and that really requires being able to kind of keep on top of the latest trends and keep learning as well. Okay. So then the focus for today then is trying to apply much of the learning from yesterday to your own work, you know, and what would a digital campaign strategy look like for you in your own organizations. But then also, I think we can start thinking collectively as well, you know, around like the movement around kind of progressive drug policy, harm reduction strategies, you know, and what would an effective, a good digital advocacy campaign look like for that, you know. So that's trying to just help guide the thinking in that direction. That's the focus for today, and then tomorrow we'll look at kind of how we would go about and actually implement that strategy then. Okay. So yeah, I'm going to give, I mentioned yesterday that over the past couple of years, I've been doing some work kind of like on the Irish side of things around kind of like progressive drug policy, and I've been involved with the Safer From Harm campaign. So I'm going to talk a little bit more about that and just show some examples of what the digital campaign for that looks like. And then we're going to break out, so that the bulk of today's session is going to be you guys working in groups, thinking through those 7 questions that we discussed yesterday, and trying to start thinking about answering some of those. We'll have a little bit of a break, and then we'll come back, we'll feed back into the wider group and start to try and answer some of those. I think we should also kind of like use that feedback session. If there's anyone else in the group who have, you know, who've had success using digital and social media as part of their work, and they would like to talk a little bit about that as well in their own context, in their own organizations, their own countries, that will provide that space to do that at that stage as well. Because, you know, I hopefully I have some of the answers, but I definitely don't claim to have them all. So I think, you know, that we can learn as much from each other as well. So hopefully that will be a good space to do that then before we wrap up for the day. Okay, so then, yeah, just wanted to talk a little bit about my involvement with the Safer From Harm campaign. So my work is primarily with the Liffey Drug Project, and so, you know, like a harm reduction service provision, but also advocacy organization based here in Dublin, but also has bases around Ireland as well. So very much have a national remit. But I started working with them in 2016. Around the introduction of supervised injecting facilities. So at that stage, and we still don't have one, but that like, I suppose Anna Liffey's primary advocacy focus at that stage was around the introduction of SIFs, you know, and there was movement politically around this as well, you know, so they're trying to really capitalize on that. But at the time, I think, you know, the arguments and the discussions, it was very much kind of on that political level, and it was kind of like health and policy focused, and my involvement with Anna Liffey at that stage was to try and bring more like human elements to it, you know, so to try and broaden the support for the introduction of supervised injection facilities, so that people will be in support of them and put more pressure on politicians to pass the legislation for their introduction, but also for the stage at when they were introduced, that people saw the value in having these kind of in our society as well. So that campaign was a collaboration with the Humans of Dublin. So you may be aware of like the Humans of New York. So there's a similar kind of outfit kind of here in Dublin. So it was a joint campaign between the Anna Liffey Drug Project and the Humans of Dublin, where we profiled 7 different people to tell their stories about why they wanted to see the introduction of SIFs, and how Irish people and Irish society would benefit from the introduction as well. So it was just kind of like that really powerful storytelling piece, and I think that it was a real, sorry, there's a couple of people here. It was a real point of difference in the campaign thus far. You know, this was the first time that we were really hearing personal stories, you know, of people who were directly affected by the issue as well, you know. So, and I think that it did change the narrative in the debate, you know, and that was the first time that we used the name Safer from Harm as well for this kind of messaging, and subsequently, you know, it was politicians were using it when they were debating the issue in Parliament, and then Anna Liffey actually took it as, you know, a core organisational message, and that has evolved a little bit over time now. So the legislation for the supervised injecting facilities did pass, and we are due to, the first one is due to open in Dublin soon. There has been complications along the way, but it's due to open soon. But the Safer from Harm campaign, yep.
I was just going to say, I've walked there. They've shown me the plans inside.
Oh, very good. Yeah, so it's in, like, they have a place for it. It's in Merchants Quay, which is another organization that also provides services as well. So yes, there was kind of objections to planning and all of that, but thankfully that's been worked through now, and it is due to open soon. So thank goodness for that. So I suppose Anna Liffey's campaigning focus and their strategic direction has shifted towards decriminalization over the last kind of couple of years as well. So, and as such, Safer from Harm has evolved alongside of that as well. So the focus of the campaign now very much is to try and build a movement behind decriminalization as well. So we get similar, building that kind of critical mass of support, so that there's kind of broader movement at a political level for this, but also just to kind of get people to understand the benefits of moving towards, you know, decriminalization, health-based approaches to people who use drugs, those kind of things, to building that support and building that understanding. Yeah, as I mentioned, so we want to influence both the policy agenda, but also public opinion, and changing the narrative around kind of people who use drugs. So some of the activities that have been involved in that. So it kind of started, and I was talking about this yesterday, and about kind of like, you know, your objectives. and making sure that you're aligned with the overall kind of campaign strategy. So obviously there are both online and offline elements to this, and it's about, okay, you know, and there are going to be specific online elements, but then it's how can online support the offline elements as well, you know? So for example, in the early stages of this, we had a series of town hall events in cities, towns across Ireland, just inviting people in, and there was a panel discussion just talking about decriminalization, the Portuguese model, all that stuff that you're very, very familiar with. But I think it was very much just introducing a lot of people to the topic as well, you know, and where we wanted to see Ireland going in that direction as well. But then I think we also wanted to try and understand where people were at currently with that. So we've done a public attitude survey and asking people, trying to understand people's support for decriminalization as well. There was a couple of reasons for that. One, just we wanted to see where people were at, but because this was at the start of the campaign, we wanted to really kind of set those benchmarks. So if we were kind of ramping up activity, we now, at a later stage, will want to run that public attitudes research again, and then be able to measure or try and measure that, okay, you know, we've been doing all of this work to try and influence the like public opinion on this. How successful have we been? You know, are people's understanding, are people's opinions shifting? Are they understanding more about what we mean by decriminalization and why we would benefit as a society from having a decriminalized system? So we ran that public attitude survey in January 2019. So yeah, we haven't rerun it yet, and the levels were okay. They weren't like, I can't remember them off the top of my head now, but you know, it did show that we had a lot of work to do, basically. But another thing that I think that's really important when you're trying to build a movement as well is that it is a movement. So whilst this is very much spearheaded by the Anna Liffey Drug Project, like they're the main advocacy organization behind Safer From Harm, we were very conscious of trying to broaden that out. And that you know, that other organizations wanted to become a part of it as well, to build support, but also similar to how we described Yes Equality yesterday, you know, it's like making people feel like this is your campaign as well, you know, so that the full buy-in, full input, full involvement. So we've been working really hard over the last maybe 2 years now at this stage to try and really kind of like build that movement. And we have kind of like formal involvement from like across civil society. So you know, civil liberties organizations across the spectrum. So it is this broad kind of movement, and they're bringing in their supporters and their bases as well. And then obviously trying to really amplify and promote all of this through our social media channels as well. So it's really strong social media element and a digital storytelling element to all of this as well. So just a bit of what that looks like. Yeah, so I think as part of that real movement building piece, Safer From Harm needed to evolve and take on its own identity. So developed its own brand, its own logo, its own website. So then, you know, it doesn't feel like Anna Liffey have ownership over this, but it's actually, it's a broader movement, it's a broader campaign. Yeah, and we'll move into the social media platforms that we use for that then. But so just this is an example of the type of content that we used. So as I mentioned, you know, the big focus was around kind of like storytelling, and we wanted to use, I suppose, influencers, or, you know, again, those kind of like high profile names, so that people will listen to, but also matching that with everyday people and their direct experiences as well. So, you know, people who use drugs, family members of people who use drugs, introducing those voices, and then also, you know, the more high profile names as well. So I'll just show you this and hopefully this works.
We need to treat drug use as a health issue and not a criminal issue.
How we currently treat drug users does not work and needs to change.
Decriminalisation is a compassionate and pragmatic response to drug use.
Criminalising people for possession does not reduce or discourage drug use.
We need to support and not shame.
People who are found in possession of drugs should always be given the opportunity to make safer and healthier choices.
These people are your mother,
Your father,
Your sister,
Your brother,
Your best mate,
your cousin,
your colleague,
your child.
Okay, so this was actually part of a bigger video piece that we done, where we had kind of like these short interviews with, you know, a mother whose child used drugs, a former police officer, you know, who's advocating for decriminalization. We had kind of a drug user herself, and those different voices. So we had kind of mini interviews with all of those. And then we had this piece at the end, which is kind of the call to action, and it was the kind of the broader support. But remember when we were talking yesterday about using video on social media and how kind of the shorter, the better works as well. So that longer video was almost like a mini documentary. That was kind of like our pillar content piece, you know, so we'd host that up on YouTube. And when people wanted to watch the full video, they can go there and that's where it is. But like, we needed to take clips of that and promote that on the other social media platforms, engage people that way, and the call to action being go to YouTube to watch the full video. So this is an example of a clip that we took from that larger piece to try and bring audiences in, to engage them on the issue, and then say, want to view more, go to YouTube. So this is less than 60 seconds. So we would have promoted this on Instagram, on Facebook, and on Twitter as well. So they still are our primary social media platforms. We tend to get good engagement actually on Facebook, and on Twitter, you know, that's kind of, I suppose, more where we're trying to influence the policy agenda and reach those kind of stakeholder groups, and also other organizations that are involved in them as well, getting their support. That takes place on Twitter. And then on Instagram, that's where we're having the most kind of, I think, success at the moment, because we're bringing in newer audiences there. I think it's because of the nature of the audiences that are there, but also because as a platform it's kind of growing, we're able to kind of capitalize on that at the moment. So we're seeing more people kind of follow the campaign there, but we are still having success on Facebook as well. And actually, I think I have an example of that here. Yeah, so this is another, so again, we really noticed that this type of content was really working for us as well, and we wanted to try and do more of it. So bringing in those different voices, and you know, who were going to be able to speak authentically about the issue, but also we're going to introduce us to new audiences as well, you know, and take the message of decriminalization to new audiences. So we've had success with this, you know, in Ireland, bringing in these kind of like high profile names. So this is an example here of PJ Gallagher. So he's a broadcaster and a comedian, and he's in kind of like a bit of a hit TV show at the moment as well. But like, very articulate, you know, very, very funny, but I suppose wouldn't have been known to have spoken on this issue before. So as we created this series called Conversations on Decriminalization, and we had PJ Gallagher involved in that. And it really just kind of struck a chord with a lot of people. I think it's because he spoke so authentically about the subject, and that it really kind of like engaged people. So and you can see kind of like the reach that we got on Facebook for that was really, really high. And this was all organic as well. So there's no paid promotion behind this, you know. And just for Anna Liffey, like, this was their best performing post on Facebook ever. You know, so the numbers there, you know, I don't know how they'll kind of compare to your own kind of organizations and stuff, but that was really, really positive for Anna Liffey. So, you know, and again, I was trying to think, okay, look, this is working. Let's try and do this a little bit more. How would you go about potentially influential people involved? Yeah, so when, again, you know, I think you need to be really careful about choosing or approaching people to be involved kind of like in the campaign as well. You don't just want like a high profile name for the sake of a high profile name. You want them to be able to speak authentically about the issue and have kind of some connection to it, you know, because that's what's going to really work. And definitely that's what we've seen has really worked in our experiences as well. So like this PJ Gallagher or Christy Moore is like, you know, a kind of an Irish legend, like kind of folk singer. And he has spoken in the past about kind of like issues around his kind of with alcohol, but he'd never spoken about being a drug user before. But when like that had such kind of impact in the campaign when he spoke about kind of his drug use, you know, and how we need to kind of treat people with more compassion. It was so powerful. So yes, like I think it is important to try and have those voices in your campaign and speaking, and because it just takes you to new audiences, gets your message out there in ways that you know, that is very difficult to do so otherwise. But I think it only is effective, or it only has real impact when they have a real kind of connection to the issue, or they're able to speak authentically about the topic as well. That's when it works best. But you know, like that's like it's difficult as well. I'm not going to lie. You know, we've like, I suppose that's probably been one of the biggest challenges, is to try and keep that momentum up and to get people involved. But you need to try and you need to try and supplement that with other content as well. You know, it's more than just that as well. And again, trying to create content that addresses some of the challenges that you're having, or that meets some of the objectives that you have. So for example, you know, what came through from the public attitude survey, and just kind of, I suppose, anecdotally, we kind of knew that people have a real that there's confusion around what decriminalization actually means, and decriminalization versus legalization and all of that, you know, and trying to unpack that and get audiences to understand what do we mean when we say decriminalization. So that still is a challenge and an objective for us, you know, so to get people to understand it and to really kind of like embrace it as well. So we wanted to kind of create content around that as well, to try and just even engage people first on, you know, this is what decriminalization means. So just here's a quick example of what that looks like. And again, taking those considerations into account, you know, keeping the videos short as possible, and also remembering that the majority of video is watched without sound. So this is like a short animation with text overlaid, so you don't need to listen to it. Okay. Okay, so you know, it's difficult to try and explain decriminalization and the differences between decrim and legalization in a short video like that. But hopefully, even kind of, you know, what it does is engages audiences on the topic and get them to think, oh, okay, you know, even just seeing that decriminalization is this, legalization is this. But what the call to action here is to learn more, visit the website and provide the link. So then, you know, if they do want to find out more about what it is, they know where to go and get that information. Okay, but it's about, as I said, kind of standing out in their feeds, engaging them at the first instance, and then directing them to where they can kind of find out a little bit more. So just had another question in there about getting those kind of influencers involved as well, and how, so this is from Shehi, and the big names in Nigeria would most likely charge a fee. Yeah, I suppose we were lucky in that sense. You know, we didn't, any of the people that we had involved, we didn't pay a fee. And I think that was through the kind of, you know, the strategic selection of who we wanted involved, you know. So again, because they're not just influencers, they're people who are kind of well known, but they are connected to the issue. And I suppose they understand that their involvement is kind of like, you know, towards an end goal, and it's part of this kind of like campaign. So it's not the same as I suppose more traditional influencer involvement in I suppose a more commercial type of relationship. You know, it was a little bit different than that. So I think it depends on who you choose, but how you approach them as well, you know. So making them understand, like, you know, your involvement is because you have a connection, or you can speak authentically to this topic, you know, and we're working towards this goal. And I think that will make a difference as well, you know. But it is difficult, and you know, I suppose the more traditional influencers might charge a fee for those as well. Okay. I think, yeah, so like that was a quick overview of the Safe from Harm campaign, and some of the content that we've been using to try and engage new audiences, introduce new audiences to the campaign, and trying to really build that grassroots movement of support behind it. You know, and I think that we have achieved, like, you know, a good bit of success with this, both in terms of, say, getting those kind of like big names in and getting that to new audiences, but just broader, like, I think, recognition of Safer from Harm as a campaign, as a brand. People now are starting to understand this. There is a bit of a movement behind it, but we still have a bit of a way to go for that. You know, there's I think politically the will is not there now, but pressure is building. So we're just going to make sure that we keep that pressure up over the next kind of like months, you know, to ensure that we do get there. So now it's over to you guys. We're going to move into the group work element of the session. So a reminder, these are the 7 questions that we outlined yesterday. So going to put you into breakout rooms again, and you're going to work through these questions, okay? So logistically, I hope this all goes to plan. But you just have to bear with me. But I've created, so I'll put you into your rooms, and then I'll come into each room. But I have a Google Doc, which I've one Google Doc per group, which I will share, and it has all of these questions in it, and it has them broken down even further to help to kind of get you to start thinking and answering them. So hopefully that this will all go okay. But I'll be floating around as well. So any questions at any stage, please do let me know. And as I mentioned, yes, you can, like, I think it'll be natural to think of the questions in relation to our own work within our own kind of like groups and organizations. But if we can kind of start to think a little bit collectively as well about our common goals and objectives as well. Okay. So just bear with me now while I break you into the different rooms. Anyone have any questions before I do so? Are we all okay? Good stuff. Okay. So I'm going to split you into 4 rooms. So there will be there will be 4 groups of 4 and 1 group of 5, I'm pretty sure. Okay, here we go. Wording here. Yeah, so as people are making their way back, maybe if you're comfortable, just stick under on your camera maybe. So we know you're there. I'm not sure if people are still away from their desks or not. Oh, cool. Thanks, Neil. Okay. Can you all see the slides okay? Yeah. Great. Yeah, so just for the remainder, we have about 40 minutes left. So yeah, I just wanted to kind of create the space to feedback from some of the discussions that you had in your group. And then also just talk about kind of like your own experiences of the work that you've been doing as it relates to digital and social media, and anything that you want to share with the wider group as well. So we'll just kind of go through each of the different questions and each of the rooms and get you all just to feedback, and we'll see how this goes. So first of all, we'll just take that first question, trying to identify some aims and objectives maybe related to the work that we're doing in our own organizations, but there might be some common objectives alongside that as well. So from breakout room 1, does somebody want to feedback on their discussions in relation to aims and objectives? Was there somebody identified from group 1? Hi, Florencia?
Yeah, me. I
Hi.
can do it. Hi. I mean, if the rest of the group are d'accord, and me. Hello. Okay.
I'm here. Sorry, I'm here, guys.
Should I do it, or someone else want to do it?
No, it's you, Florencia. You are the leader.
Yeah.
You've been nominated for it. Yeah.
Okay. Sorry about my English. It's very oxidate, but I will do my best. I promise. I'll try. So, well, first we put all together our things that we have in common, because we don't know each other. So it's important to know each other and know what we want to talk. And so after, well, a little chat, we decide to talk about the drugs policy and how to go out of the psychoactive closet, no? To sensibilize people who use drugs, to encourage them to go out and show themselves as drug user, but also work with their friends of those persons that judge them for being a drug user, even if they are drug users also. So educating people in different countries in native language, of course, to make because we are from different parts of the world. So for example, I'm from Spain, so we should do the campaign here in Spanish. And because I live in Barcelona, in Catalan, or also in Vienna in French or German or English, and so on. And raise awareness and wish to engage. Connecting through Europe show that change is happening everywhere. Also, drug use is a personal choice. Campaign to change the attitude of people who use drugs and to change this mind of disease, like without any cure, and that is the end of the world. It's not. But we want to focus, because this is a very a huge group of people. We want to focus on young people, especially because all this situation start when you feel pressed by your group of peers. So for one hand, you have a 14 years old boy like, we are going to drink today. But in the other hand, maybe there's someone in the group that they don't want to drink. So fertilize that the idea of, if you don't want to drink, it's okay. Yeah. If you want to drink, it's okay. But you have to know the basic information about what are you going to do to make a very responsible choice and decision, because it's yours. It's not from your friend. You are not a loser because you are going to drink or not to drink, or drug use. So we target for the most younger people. Then what we want to say, I think I already say it, but yeah, drug use is a personal choice. The attitude of people who don't use drugs in front of people who use drugs, respect our decision, and because all this respect behavior motivate for people who really struggle with drugs to ask for help. No. Of course, all this with gender perspective, because women is also very important in this situation. Then
the platforms.
The platform, yes, the platform would be a YouTube channel, then Instagram profile, and also as a super goal, a website where we can unify all these project persons, initiative, drug information related to drug and how to go out of this psychiatric closet initiatives in one website, because we think there's a lot of website with all this information, but if you don't work in the field, you don't reach those websites. You know, because we are connected in somehow in this area, no? But we want to make this information more near accessible for these people who don't work in this field. For example, I have friends who use marijuana, but they don't know that there's, I don't know, just rice or energy control here is super famous, but just in people who is very involved in drug use. It's not for everyone. So maybe a website more accessible for every kind of people. What else?
Did you get on to talking about the content strategy? So what would your content look like on these channels?
Yes, we were thinking in YouTube channel, not too long videos, not too long, informative, and make an engagement with the campaign. Also, these videos, we were thinking make a question for a young who start to consume alcohol, for example, and ask them, do you remember your first phase when you drink alcohol for the first time? try and make an effort and remember, no? And a lot of people would say like, it's not a very good taste at the beginning. So, well, make a video, like really short videos, not too long, and post it on Instagram and the YouTube channel. Maybe in YouTube channel will be more explanation about the effects, maybe like more informative, as I said before. But in Instagram, it's more like to reach and young people, to make followers and likes. And our super goal will be like being referent of another people for another people, and how to say, like,
Sorry, what did you say, your super goal?
What?
Sorry, what was the super goal?
Like make people share our content.
Okay, yeah.
Like diversify all the content around the world, maybe. Also in the website with basic information, maybe if someone wants to make a shirt or stickers, or like with the campaign, we don't have any, how to say, lema. Somebody says lema, like a slogan. Slogan. Maybe they can make an engagement through going to the website and make a donation, or buying a sticker. Well, that's something just occurred to me now. Sorry, group, but like to engage our audience, to, I don't know, make shirts or like this merchandising thing with the slogan, like this, support don't punish, but, or as another partners comment before, in Berlin, this lemma, this slogan, it's my brain, my decision. No?
Yeah.
And
you've kind of identified some kind of goals in there as well. Is there anything else you'd like to add?
Group? I don't know if the rest of the group.
Yeah, I would like to add something. Like I said in the chat, I do have a channel since like about a month or a month and a half, where I'm trying to engage like German-speaking people, because I think there's like a lot of content in English-speaking countries already, or like in language, and I'm trying to like put that in short videos, like easy to understand. And I'm already having like contact with other groups, like of course with the SSDP Berlin, for example. And I will talk to the girls from my brain, my choice. They are also very fresh, and they started a petition for a better drug policy in Germany just now. Yeah, from my experience, there are people already involved in these things, and I think it's very important to connect with the people from your nation or from your language, and to build something together. And yeah, I would say the interest is there, and yeah, I have the impression that there's like a lot of potential. And I also like design some stickers for support and punish. And I think like if you're trying to do cool things, cool designs, then people will want them. And like the support and punish stickers will be distributed when they are printed, I hope like in the next couple of weeks, to different locations in whole Europe. And I think that will be a possibility to raise awareness, like quite low key and quite cheap. You just like stickering your cities, and the stickers look like baggies with different substances and with like joints and syringes and like very stigmatized things, with like harm reduction messages. And yeah, I think there's like much potential if you're willing to get creative. And I think it's very important to connect each other, and to like, yeah, connect in your country and on your language, and then also to connect with other places and to show how much is happening in Europe.
Thanks for that, Carolina. And Florencia as well for your contributions there. I think there was a couple of really interesting things that you highlighted. So Florencia, you talked about kind of like the audiences first, kind of like drug users, their friends, young people that go around raising awareness. But also I liked how you mentioned about kind of showing that change is happening as well, you know, and I think that is important, being able to kind of demonstrate that, because I think people respond well when you can kind of demonstrate, hey, look, you know, change is happening and it's okay, you know, and it's done elsewhere and it's okay. I think that's kind of quite positive. I liked when you were talking about the what are you going to say and the framing, about kind of having that informed kind of like language and the responsibility, but that it's all back to that kind of respect piece, and respecting kind of like, you know, our decision. You know, we're making this choice. It's an informed choice. It's up to you to kind of respect that choice, you know. So I think that's really important. And then I think that also speaks to that kind of values piece that we were talking about yesterday. And I think respect is kind of something that hopefully is kind of like universal as well, and a lot of people can connect to. Yeah, and then I liked it when you were talking about kind of like the channels and having kind of like the website almost as a central hub. And I agree, you know, often there's a lot of kind of different sites and different resources available, and trying to collate that is important. But then I think, you know, the challenge is actually still making that accessible. You know, and especially when we're trying to reach new audiences, it's actually, you know, getting people to that website. So that's kind of important as well. So how do you kind of like bring new audiences so that they can kind of get all of the relevant information that they need? But and in terms of the content that you talked about as well, the questions, I do think kind of posing those questions, that actually is engaging, because I think people do take notice to that. So I think that was kind of clever as well. So all in all, really good. Carolina, I completely agree as well about kind of coordinating efforts where you can do that. It's really effective, and I think is really important as well, because, you know, not only do you have kind of common objectives and common goals, but like I think it's important where you can to support that and to amplify the different work that is being done, you know, and also yeah, supporting each other, but utilizing kind of like resources that other groups have, and what can you offer to other groups, you know. And I think that is where, and as I mentioned earlier, that has a more of a broader appeal as well, and has a bit more of a movement feel about it. So yeah, I think all in all, I think that's really good. So thank you very much, group one. So can we move on to group two? Somebody from group two just want to take us through what they discussed? Did you nominate someone?
So were we group two? I think, yeah. Cool.
Oh, I think you were, yeah, Kira.
Yeah. I don't know, we didn't nominate someone, did we?
Are you happy enough to take the reins?
Sure. Do either of you, anyone else want to speak? No?
I think you should give it, Kira.
Okay. So yeah, I guess we kind of were like, oh, what topic do we do? So we kind of went with, we focused on overdose awareness, but we kind of, we wanted to look at this different idea of, because, you know, a lot of the focus at the moment on overdose awareness is like, you know, just knowing how to respond to an overdose. But we also wanted to really focus on young people who take drugs, and also people who are maybe taking drugs for, you know, the first time or the second time, and aren't aware of dose literacy. So like they don't know what is a low risk dose. So that's why they don't prevent the overdose, or they don't prevent the risks of drugs. So we wanted to kind of include that. So our aim is really to improve the kind of causes, awareness of the causes of overdose, in addition to how people can respond. So we had a few target audiences, because we obviously had the young people themselves, but then also we saw that this was like an opportunity to reduce stigma too. So we had like the general public and also the police who could help respond to overdoses in a better way. What we were going to say, let me find the notes. So yeah, we thought there would be like overall some messages for like NGOs and stuff like that. We would be focusing on this like positivity around having compassion for people who take drugs, like this kind of like we love people who use drugs approach. And then when we were thinking about, we kind of split it into three different messages that we would have. So for the public, we would kind of have like people who take drugs matter. And then for young people, we kind of had this thing of like, be dose aware, and you can take more, but you can't take less, and leave no one behind. And then obviously adding in stuff for other drug users as well, who may be a bit more experienced, just so there's also that message. We had like naloxone, their life is in your hands. We thought that was quite a good one.
What was that last one, sorry?
Like naloxone, their life is in your hands. We thought you could have someone holding some naloxone. Quite cool. So the platforms we would use, we thought it would be really good to have like some videos on YouTube, and obviously just we thought we'd kind of like, you know, do cross-platform posting on Instagram and Facebook and YouTube, but also because we're looking for younger people, we could also maybe look at platforms like TikTok, because that's kind of become there's I think even at the moment there's like a lot of TikTok people sharing information about how to protest safely and like you know, digital security. So actually there is that other side to TikTok than just silly videos about dancing. And we also thought for another platform we'd have was obviously like a newsletter to send to NGOs with a call to action, like a pledge that they're going to kind of engage with it. What else did we say? Yeah, so our strategy, what was our content strategy? We kind of, we just actually, we listed what we would do. So we thought, similarly to what Florencia was saying, it would be good to have, you know, some kind of main website that was like central. So it's kind of like one thing where people can go, and resources that are available in different languages, and then we also thought like the kind of the format on Instagram that people do, where you can have like 10 photographs and it's kind of almost like 10 different slides. Those are like really popular at the moment, and then that can also be kind of syndicated across Facebook stories and Instagram stories, and it can like be shared also like similarly on TikTok and so on. So that was kind of our strategy, was to like saturate content in ways that seem kind of like popular at the moment. And what's the next? How will we engage our audience? So we discovered actually in this team as well that we had all the skills we needed, because Nina can make videos, Rosen can make websites, and can write the blogs, Serhan can do the storytelling. So actually we'd be okay. We'd be able to cover all of our graphics.
You formed a little campaign team.
Yeah. So we've got all the roles. And how would we engage? So this kind of idea of like getting people to like, you know, make a pledge, and to like share stuff. And what was the other thing? We had a wee statement. Where's that gone? So like this pledge of like, if you see something, do something, to encourage people to help with their friends, and then also doing these kind of like questionnaires of seeing what myths people have already. So like around dose and around overdose responses. So then it's like it engages people to find like the right answer that the message that you're wanting them to take on. And did we get as far? So we just started looking at what success meant, and we didn't actually discuss that.
Okay.
But I'm sure everyone would agree that success would look like, you know, engagement with the content and it kind of, you know, being widely used, but then also feedback in some way that people were going like, oh wow, we didn't know that. Actually now maybe we'll be more aware of doses, and now we know what to do when there's an overdose. So some kind of like traction on the posts.
Excellent. Thank you very much, Kira. Does anyone else from that group have anything to add? Or Kira was very comprehensive by the sounds of it. Yeah, okay. Yeah, no, that was really good. It sounds like you made some great kind of progress there through the questions. I like the fact that you say identified that focus around kind of like overdose awareness. And even I think you're a little bit more specific even with the dose literacy. I think that's really interesting as well, you know, and I think, you know, when we are kind of planning these things, the more specific the kind of the better as well. So I think that's really good. Yeah, and I like the way you clearly had thought through the different audiences, but as well kind of like what content you needed for the different audiences, and even the actions for the different audiences to take. So then, so like with the newsletter pledge for the NGOs, even thinking of the messages for the public, people matter, be dose aware, like really good. You've come up with some really good, strong messages even within that. If you see something, do something. So, you know, definitely the creative juices were flowing there. Yeah, so look, I think that you're on it. You know, the only thing I liked the suggestion around kind of like looking at the different platforms and cross-posting, but what's working well on those platforms at the moment and doing that. So with the kind of the 10 photos on Instagram, so you clearly kind of like thought through that, and that's actually really important, thinking about the specific platforms and how best to kind of repurpose or repackage the content specifically for those platforms, rather than a blanket all same approach for across the different platforms. So that's really good. And like, you know, thinking even, yeah, young people are the primary audience here. They're all using TikTok. How do we get in on that? So I think that that's really clever. For anyone actually, just while I think of it, for anyone who's looking to say, start thinking about how you would use TikTok, there's actually a really good example from Ireland that I think you could look at. It was actually a campaign done by the Dublin Rape Crisis Centre, but it was around consent. And the hashtag was called 100consent. So hashtag the number 100 and then consent. But they partnered with kind of a number of high, like, you know, Irish influencers on TikTok. But it was really effective because I think it was innovative in its design. But what I really liked about it was that the Dublin Rape Crisis Centre hosted workshops for the influencers where they took them through everything to do with consent, and they fully informed them on all of the language and everything first. And then those influencers kind of went away and they created their own content for their audiences on TikTok. You know, so it was still authentic, it was still compelling, and, you know, it was still relevant to their followers, rather than simply just taking Dublin Rape Crisis Centre messaging and putting it out. They actually kind of fully took it all on board and then created their own content. So I think it is an example of an effective way of using that platform and still being authentic and relevant for your followers as well. So if you want to check out how TikTok is used, I would recommend having a look at that. Yeah, okay. Thank you very much to Kira and to Group 2. Okay, so group, just conscious of time now, so we'll fly on to Group 3. somebody who from group 3 want to come in there?
I think I was picked. Lisa won't, but unless someone else would like to do it.
No bother. Off you go.
What you call it? I'll try to go fast anyway. So we were looking at our different contexts, which was basically Nigeria, Lithuania, Australia, and in global for UTRIs and Y+. But what you called, I guess, one of the key things that is often an issue for all those groups is about people, members of those inadequately served populations often being misrepresented and not treated like human beings. Shay was talking a lot about how just starting the conversation is very difficult because it just doesn't, it's such a stigmatized topic. So I guess that was on one side, and then on the other you have there's a lot of misinformation out there, and in the context of COVID, for example, for people living with HIV, having that sort of link with people about data that is actually relevant to people, young people living with HIV.
Mm-hmm.
So I guess the thing with us, the core sort of central theme between it was trying to shift the narrative and shift the public perception of all the key affected populations. And the way to do that, really, we were thinking along the lines of, where are we going now? Yeah, so basically, in a nutshell, what we're talking about is presenting people's stories and trying to move away and shift the narrative away from stigmatizing language and some of the other negative language used for all the different key affected populations, and try to have more positive stories. And where that's not possible in a highly stigmatized or context, in Lithuania they use Borrow Your Voice, where they had people living with HIV who could speak through other people. So it didn't have to be the person themselves, but it was, if you know what I mean.
Yeah.
And then the one thing I was thinking too between those is that, like, really I would love to see more of a open source type system emerging, where because you had some great campaigns in Lithuania. You have Chase the Virus, Not the People. In Nigeria, we are the people. And then in Australia is Heard Not Harmed. But I think so often you have this sort of I personally feel I benefit from interacting with international groups the whole time, but that's on an individual level. But it would be nice to be able to spread that out, not only from individual level, but within our communities, so that you have those different global perspectives that can help shape your argument in a sort of transcultural way, as it were, and that you could use some of the resources that you build up, because they're often siloed together in a more sort of open source fashion that you can distribute and use in different contexts in different ways. Now, obviously, it's never going to apply the whole time the same, but it was just trying to build some sort of system.
No, I
yeah,
think that's a great idea. Yeah. And as you said, it's not like, it mightn't directly apply, but even if you're able to take inspiration and adapt it in your own kind of local context, but because there are lots of clever kind of campaigns and kind of creatives, so where we can kind of take inspiration from that, it's a great idea. Sorry, continue.
I know, just Stephen, sorry, and I'm sure other people from the group would like to add, but I guess even just from working on another project recently, is even trying to find pictures about drugs is you have to pay for the pictures often, or you fair enough, you can get some nice pictures from, or you often have to pay for them, but just having a sort of system where we don't have to reinvent the wheel the whole time, but we can just constantly adapt and change and amend, and the only way to do that is making it open source, Creative Commons, that type of stuff.
Yeah, I couldn't agree more. I think that's a really good idea, good suggestion. And maybe that's kind of something even to take from this session. But can you start creating a central hub for all of yourselves working in different contexts where you can share those kind of good practices and lessons and learn, you know, that would be really, really useful, very effective. Cool. Thanks, Florian. Anyone else from that group want to add anything before we move on? Good stuff. Okay, thanks, Florian. So the group 4 then, somebody from that group want to volunteer? Do we have someone from group 4? Who was in there? MJ, is that your or Ruby?
Yeah, we didn't actually nominate anyone. My internet's pretty fucking shit here, so I can't do the video so good. I mean, I don't mind going through it if no one else wants to. Okay, I'll take that as a yes.
Thanks,
cool. So we had campaigns and organizations from Australia, that's Liana. We had Ireland, which is Ruby, and Nepal, which is Govinda, and then myself from South Africa. So the discussions were kind of based around either campaigns or the approaches adopted by different organizations. And this determined the different aims and objectives for the first question. Yeah, and the target audiences also they steered which social media platforms were being used. So one thing that, you know, both myself and Liana identified was that Twitter, we were both using Twitter on a more kind of formal approach, you know, more geared towards kind of maybe academic studies or reposting papers or articles and that. Govinda mentioned TikTok, which I know fuck all about. I don't know who else uses it. So yeah, that TikTok kind of seemed to be more relevant and used amongst a bit younger audience. Yeah, sorry, I'm trying to go quite quickly through all of them because I don't really want to mess around. Yeah, so what each person was gonna say kind of differed amongst the campaigns. And also engaging with our target audiences. So for me personally in South Africa, it's quite difficult because our target audience is generally street-based people who use drugs, and many of these people do not have access to the technology where they can engage with and interact with social media. So the interaction which we are doing is very much face-to-face, and obviously that's a problem now with COVID-19 restrictions. Yeah, so, and then Ruby, who runs the Instagram account for a Youth Rise. She has been doing some innovative things, having Ailish, the international coordinator, like maybe take over the Instagram for the day, or, you know, like proposing polls or questions. So she used that as a way to engage with the audience. Govinda's campaign, he did share a link to the website with us. I don't know, Govinda, maybe you can share it in the chat so everyone could have a look at that. Yeah, sorry, let me just have a look at the rest of the questions. So what platforms? Yeah, so I think it was spread amongst all of us. The organizations that we each work for vary in sizes. So, you know, maybe each organization didn't have a dedicated or focused social media or communications person. But generally, I think most people used Facebook. That was quite a common one. And with younger target audiences like Instagram, TikTok, you know, seem to be quite popular. So one thing that we also mentioned was that cool organizations can have and should have a social media presence, but perhaps if it's not done effectively, it could be to the detriment of either the campaign or the organization. So if it's kind of inconsistent posting, maybe still stuck in like the crawl phase or just after, you know, maybe that can be detrimental in some cases. And then just looking at the last question. yeah, success. I mean, fuck, that was quite hard to measure.
Yeah.
An interesting example was I think it was, oh yeah, with Ruby in Ireland, they like did a campaign around distributing pill testing and stuff like that. And although the testing kits weren't like, it didn't result in them being distributed like officially, it created a lot of news media and exposure. So we were kind of discussing, is that a kind of a metric of success? Was that successful that they generated exposure and noise around that, which we thought it was. I thought it was quite successful. But yeah, I think for success, it was clear to identify and outline clear aims and objectives and have your goals be measurable and meaningful so that you can actually identify and evaluate if you've been successful, if that's your metric. Yeah, and I think that was it. Short and sweet, that's it.
Yeah, cool. Thanks for that, MJ. I think you're right. Look, and for me, like if you can kind of take that away, even from the session, that just trying to identify what does kind of count as meaningful engagements related to those objectives that you've set. I think that's really important. And also, that mightn't be necessarily 100% clear at the outset. But as you're kind of like working through, you can say, oh yeah, like, look, this is generating a lot of wider media coverage. And as a result of that, you're noticing that is success. You want to try and amplify that even more, but it's been able to, I suppose, monitor that and respond as it's taking place.
Yeah, sure.
Okay.
I just want to give quickly just a chance to anyone else in the group if they want to share something, because I missed a lot of things. So if there's anything important anyone else would like to share quick in our group.
Yeah, anyone else from the MJ's group want to come in there? I think we have it all covered.
No, thanks, MJ. I think that covered everything.
Okay. Thanks a million. Look, hopefully you found that session useful. I appreciate it'll be difficult to kind of fully answer all of those kind of questions, especially considering your kind of different contexts, different countries, different perspectives. But hopefully, it just takes what we learned a little bit yesterday, demonstrates how to actually put that into practice for your own organizations moving forward, and then collectively as a bit of a movement as well. Picking up what Florian was saying there about trying to create that kind of central hub of resources where you're able to exchange knowledge, skills, experiences, good practices. Okay, just before we finish up then, can you still see my screen okay? Yeah. Tomorrow, not tomorrow, we break tomorrow, Thursday. So Thursday, for the final session, we're going to be looking very much at kind of implementation, okay? And it will be the tips and tools to help kind of create some of this stuff. So for social media monitoring, listening, management, but also for creating content as well. So creating graphics, creating infographics, creating those short animations, and they're all kind of tools that are either free or low cost. So it'll be kind of like a demonstration of those tools, and then again we'll just kind of like work in our own groups to try and think of, and test out some of these tools and start creating some content for our own kind of work and our own social media channels. Does that sound okay? I'm conscious that I did also say, that we provide the space for people to talk about kind of like the work that they're doing in their own organizations and share good practices. We didn't get to cover that today, so I'll make sure that we create the space for that on Thursday as well. Any final questions before we finish up?
Nope.
Okay. Well then, I'll just say thank you again for your attention this afternoon, or this morning or this evening, wherever you are. Yeah, and again, I hope you found it useful, and I will speak to you all on Thursday.
Thank you very much.
Thank
Bye
you.
now.
Group.
Thank you,
Bye,
Craig. Bye.
everybody.
Bye.
Bye, everyone. Bye.
Bye, guys.